Today our topics of our lecture, it is planning in healthcare. Planning in healthcare, what it means? What it is planning? Planning, according definition in Wikipedia, most popular resource in internet. It is a process of thinking about and organizing the activities required to achieve some goals. And according definition by Webster, it is an act of the process of making plan to achieve or do something, like planning some activities or to getting to achieve some goals. And it means the process of setting some goals which need for us. What it is a planning? It is a common picture how we can define it. From our point of view, like a specialist in public health, our common goal it is a health community. Health community, it doesn't matter, a health community of town or city or village or common or whole country or part of the world or whole world from point of view WHO. It doesn't matter, but main goal will be achieve healthy community. So, and planning it's like a road. What we should to do to achieve this peak of mountain. So, planning it is deciding what we should to do, how we should to do, who will be responsible for that, and what we should to do in this certain moment. Next, planning could be according to this table. Planning could be strategic. Strategic, it is strategy. It's common, huge plan. Tactical, it's mean what we should to do in a concrete situation, in a concrete place, in a concrete conditions. What we should to do. And operational, it's mean what we should to do and what we need to evaluate. What we should to do in a certain moment. So, and we have from that depends levels and persons who will be responsible for that, and also time. So, who develops, who will be responsible for that, who will be responsible for developing. For a strategic, it is will be upper level managers. It is Ministry of Health, if it will be in a country, or responsible managers of WHO if we understand it like from point of view of whole world. Next, in a tactical will be lower level. For example, in Kazakhstan it is will be heads of healthcare departments, regional healthcare departments. For example, Karaganda regional department, healthcare department, or Astana, Almaty healthcare departments. And operational, it is will be responsible all managers. All managers, it's like heads of hospitals, heads of ambulatories, or maybe heads of any kinds of facilities in this region, in this city, in this town. And analysis in time. When we need to analyze, when we need to evaluate this process, what we already get, what we should to do, and what we're planning. The future, strategic, the future. It's mean what strategy will develop for a period, 5 year, 10 year, or maybe even bigger period of time. And at tactical, it is a everyday functioning. It is dividing of big strategic plan into different stages, different steps. And operational, it's mean task by task, day by day. It is everyday activity, what we should to do to get to achieve all goals in this types of tactical planning and also strategical planning. And next, it is based primarily on strategic, based on prediction of the future. What we need in the future, how we see all common picture, what we want to achieve. A tactical plan. A tactical plan, it's known like a circumstance that exists within a system. We need more concrete than a strategic, more concrete, more detailed plan. And at operational stage, at operational level, at operational planning, will depend from a situation, concrete certain situation in this time, in this period, and focus it on. At strategic level, most, like I already said, it is based and focused for long term periods of time. It is around 3, 5 or 10 years or maybe bigger. Tactical, it is a shorter period of time, for example, maybe 5, 3 or 1 year, or maybe less if we need to develop some tactical plan to improve health situation right now, maybe after half of year. And operational plan, it is now, today, tomorrow, this week, this month. For example, it will be like a quarantine in school, for example, which types of activity help to us prevent influence epidemic or something else. So, and health system in most countries it's provide comprehensive range of services to entire population and to ensure these standards of quality, of equity and responsiveness are maintained. So it is according to WHO glossary what it means healthcare planning. In orderly, so it is a process of organizing decisions and actions to achieve some goals, what we need to get, and we need to do it through implement some policies, some guidance, what we should do in our situation. And also it is a code word for a public decision when we and how we can make towards to the future. Often use interchangeably with the policy formation or development strategies and programs. And right now, after finishing of previous Salamati Kazakhstan health development, healthcare system development program, right now starting from 2016 year, start another program for a healthcare development system. It is a program of Densolik until 2020. So, health care plan can be, according all main experience of all world, can be like a dispersed health planning when we have some various types of goals what we need to achieve. Focused health planning, it's can be like we can focus only at one goal, or maybe we can focus only at a specific group of population. For example, children, or maybe old, or maybe at pregnant women, or maternal population. Then central health planning, when one government body will be responsible for all central body, like a Ministry of Health, or maybe another, maybe agents, some types of agencies will be responsible for providing all policies about what will be about public health system. And integrated health planning, it is will be like a common mix from these three types, and it consists from different various elements of which consist these central, focused and dispersed health planning type systems. So, plan consists of from five basic elements. First, it is from objectives or with the goals. It is our end point of our plan. It is a final goals, what we should achieve in the end of all our activities, of all our steps and stages and steps. Policies, it's like guiding principles. Policies, it's mean we should do it like this, like this, like this, but haven't any concrete directives what we should do in this common situation. And it's guiding principles. After policies, it will be programs. Programs already in frameworks of policies. Program will be like a more concrete than policies, and it will be a sequence. A sequence, it's mean like a step-by-step activity. What we should to do, what we get, what we must to implement these policies, and to accomplish these objectives, like a step-by-step approach to guide. For event, it is a schedules. Schedules, it is like a program, but already with a time period. What we should do with a time sequence. So what we should do after 1 week, after 1 day, after 1 year, for example, and what we should do in more in this concrete period of time. What type of work must be done in a certain time, or tomorrow or after tomorrow. And also very important for this, it is a budget, because like we know from economical theory, or human wishes are limitless or unlimited, but we have limited resources for implemented for done to be done to implement this work, to get to achieve our main goals. And it is schematically planning cycle. It is like a common scheme, but more concrete for the exactly for a healthcare system. It is will be next. So here, all started from analysis of health situation. We need to analyze in this certain time what we already have. We need to find some key indicators in this time in country, in region, and then we, after analyzing of health situation, we need to understand what we should do, what we want to do, and what we see in the future in our region, in our country, objectives and goals which we want to achieve. So maybe like a concrete dinsoluk, we want to reduce maternal mortality until, I don't know, we want to reduce maternal mortality, we want to increase life expectancy until 70.3 of life expectancy. And after this, we need to assess our resources, what we already have. It is in resources we can include also our knowledge, our materials, our human resource, our money budget, what we can spend to achieve these objectives and goals. And we need to find some way what will be cheapest, but we don't need, we must to know always, and we have to remember about some balance between cost and efficiency. Always we need priorities. So we need, after assess of resources, after assess of our material base, after assessment of our equipment resource, of our human resource, of money budget, we need to find priorities. After finding and make a decision what we need to achieve these objectives and these goals, we need to find the priorities. So what will be for us more important? What will be for us a little bit at second stage? And after this, we need to formulate plan. Here, when we plan about objectives and goals, it will be like a common or a first stage of this planning. And after this, we need to formulate all plan, already concrete plan with the stages, with the events. And after this, after formulating plan, will be next stage. It is already programming and implementation. Programming, it's mean to mix this our already formulated plan with a time schedule. And it is already, we can see concrete implementation by day, by week, by year. And when we already start our activity after programming and implementation it's mean what we already start our activity. And after starting of our activity, we need to monitor this system. This monitoring system, we have some special frameworks of this program. And if we have some problems, if we find get some activities or some stages not lay inside the borders of our frameworks, we need to assess why it was in this type, and then we must decide what we should do to return this into borders of our programming, so to get of normal way. And after monitoring, we already have evaluation. Evaluation, it is like our final stage of our planning. We already evaluate our goals. Achieve we these goals and these objectives or not yet. And if it already done, we can start another type of another stage, another cycle, another planning cycle. But if in this case, if we not yet achieved our goals, what we planned in the starting of our planning cycle, we need to return this stage at formulating plan and program implementation and find our errors and mistakes and what was wrong in this system and why we can't get these objectives and goals. Then, analysis of the health situation. Analysis of the health situation consists from a collection, assessment, and interpretation of information to understand this picture, this condition, what we already have right now in certain moment when we assess in this time. For example, it will be concrete statistical data, what we have at this certain time at our region or on the whole country, and we can find some key digits of some key numbers and some points what must be improved, and we must to start plan. For example, we need to improve condition of health of children, and we should to decide what we should to do. We must to decide what we should to do in this time, and we should to plan what we must or we want improve health conditions of children, and then we will start establishment of objectives and goals. So we already tried to define what we should to do, and also objectives and goals have some requirements. So first, it should be set by a person having authority. So no one, no me, no another people can't provide and can to understand what will be objectives and goals in our for our future activity. Like a person who have an authority. Authority having it is in our country highest rank. It is a president Republic of Kazakhstan, Nursultanovich Nazarbayev. Also underline it is prime minister, vice prime minister who responsible for direction of healthcare, and also Ministry of Health Care and Social Development, and also Deputy Minister. Right now it is Birtanov Iljan Amatayevich, who is responsible for direction of healthcare. Then the goal should be realistic. Goal should be realistic. It's mean what we need to get some realistic points. We need because, for example, to increase life expectancy of all Kazakhstan citizens till the 100 year. All we understand what it is impossible. So we can take the goal, for example, 70, 75. It is will be realistic for our today system. It should be specific, because goals should be specific. It's mean what it will be in area of healthcare system. Maybe here it's mean what we don't need to divide money or to spend money or budget, for example, to catching some animals, catching some animals, maybe some cats, some dogs, and it's mean what we can to improve conditions, sanitary condition of our town, our cities. But we need to spend money exactly for what I need to, for example, to improve, to increase life expectancy. Acceptability. Acceptability, it's mean what this goal also must be acceptable, not only for a high level a person with a high authority, high level managers, or maybe for managers of medium level, but also it must be acceptability for all population of all country, and for all managers at all levels. And easy measurable. Easy measurable. It's mean what exactly. It's mean what even non-specialist can understand. What goal mean? Because if we have some complicated definitions with very clever words, it will be understanding for very less numbers of people who can understand this, and very complicated methodics how we can evaluate. Can we achieve this goal easily or not? Next, assessment of resource. Assessment of resources what we have, it is will be like a manpower, or it is around human resource. We need to evaluate have we enough number of doctors, so we have enough number of nurses or not for implemented for to be done this our goal or not. We have evaluate assess money budget will be enough for our to achieve our goals or not. Materials it's mean have we enough infrastructure and enough level of equipment, of not only laboratory equipment, it is equipment of hospitals, of any facilities, it will be enough or not. Skills. Skills, it have closest understanding with human resource. Have we enough number of skilled human resource or not? Knowledge. Can we get at our stage of our of our healthcare system? Can we implement this type of activity or these goals, or maybe for our system it will be a little bit complicated. Techniques and knowledge, it also depends from one from another. Techniques which we can use to achieve these goals will depend from knowledge. And also we need to assess the time. Have we enough period of time? Have we enough time for implementing this or not? Because maybe we can't to achieve a goal to improve healthcare situation, to increase life expectancy until 90 years for every citizen. But it will be after 1 century, maybe 100 years. And who will be responsible for that? We already can't find answer for this. So also we need to assess time, to concretize periods of time in which they must be implemented and they must be done. And fixing priorities. Fixing priorities, it is a mean. Need we understand to go by this way, or we need to find some another way, or we need to find our own way to, or we can take experience of another countries, or we can mix all these priorities. And also it is established in order of importance or magnitude. It is science from resource always fall short of the total requirement. And second event, it is depends on financial constraints, mortality and morbidity data, diseases, which can be prevented with so cheap cost like it's possible, and saving lives of younger people, political and community interest and pressures. So have we some problems in this or not? And we need to write up a formulated plan. So what it's mean formulated plan? We already discussed. Formulated plan, it's must be activities mixed with time schedule, already with like a graphics, and detailed detecting input and outputs, contained working guidance for execution, and also evaluation should be built in. So after this, programming and implementation. After programming and implementation, we must do next events, like assign and fix responsibilities. Who will be responsible for each stage or each step of our program. Define roles and tasks. Who will be responsible? For example, high-level managers will be responsible for that. And at this time, and they should to do this concrete type of activity. Medium level managers will be responsible for another activity and for at another time, and lowest managers will be responsible for different various tasks and activities. Selection, training, motivation and supervision. We need to find some key persons who will be responsible for conducting and implementation of our plan. After this, organization and communication. We need to communicate very fast to decide the problem of time wasting. And we need to evaluate and programming of health institutions. We need to assess efficiency, how we must evaluate efficiency of these health institutions because very many various countries have some problems with some bureaucracy problems and also in healthcare system also. Monitoring. Monitoring it's mean what we day by day understand when we at this certain time what we already done, what we should do, and it's day-to-day follow-up. It is a continuous process of observing, recording, and reporting of activities of the organization or project, what must be done. It is consist from a keeping track, of course, of activities. It's mean we in right direction or we in wrong direction. We must understand in this type. Identifying deviations here, like we already know, identifying deviations. We need to understand how we deviations from borders of our from our frameworks or not. If we already have, we do some extra events and take all our activity already into these frameworks and taking corrective actions if excessive deviations occur. It is like already said, we have some we need to conduct some corrective actions if we already identify and find some deviations from our plan. And evaluation, after implementing monitoring, we have evaluation, what we already done, and purpose of evaluation, it is assess of our achievement of our objectives, our goals of our program. Adequacy, it was adequacy and efficiency of our program. Was it effective, was it adequate, or maybe not? Mostly concerned with the final outcome and with the factors which was associated with it. And also at this evaluation, at stage evaluation, we need to understand if we already get, we must to find another goals, another problems, so what we need to decide. But if in a case, if we have some deviation from our frameworks or we not yet achieved our goal, we need to return back in our planning cycle stage, and we need to repeat our activity, and we must understand where we can find this error, these mistakes, which was through our planning cycle. And in most countries, healthcare capacity planning takes place at national, regional, and local level. And also it is reflecting from various tiers of government with healthcare system. And also, for example, in Kazakhstan, we have a high level, it is a Ministry of Healthcare and Social Development. Under this, we have health independent, it is like at health, regional healthcare departments, they have both understanding, and Ministry of Healthcare and National Development will be like a highest regulator of all policies in a country, but all main activity depends from a regional healthcare department, and also healthcare department divided into facilities on different levels, like cities levels, like central areas levels, and like small regional areas. And thank you for your attention.